Good morning. I'll be doing an informative speech on Hodgkin's lymphoma, a type of cancer. Lymphomas are well known in the world of cancer, specifically tumors in the immune system. They are often categorized by Hodgkin's lymphoma and non-Hodgkin's lymphomas, both presenting themselves in a similar manner with rare and specific differences. This presentation will focus primarily on Hodgkin's lymphoma, formerly known to many as Hodgkin's disease, its origin, development in the scientific world, and evolved treatments thereof. Hodgkin's lymphoma, though discovered as early as the 1600s, was properly named in 1865 in a paper written by Samuel Wilkes, well after Thomas Hodgkin's study of morbid appearances throughout the body. According to the epidemiology section of William Townsend's and David Lynch's 2012 seminar on Hodgkin's lymphoma in adults, this rare malignancy is more frequent in men than in women, and generally peak in young adults and those of 60 years and older. Though this rate of incidence has remained fairly unchanged over the last 20 years, there have been significant advances in the understanding of the disease and its progression in the body. Next slide. That right there is a picture of the lymphatic system throughout the human body. Highlights the main points of the different lymph nodes inside the body where Hodgkin's disease is more likely to be found. A question often asked about any disease is the role of hereditary traits. As Gabi, Ferreri, Ponzini, and Levi explained in their 2012 critically reviewed study, Hodgkin lymphoma, this malignancy as an inherited disease remains to be defined. They do, however, note hypotheses being researched on specific pathogenic processes of young adults as well as the elderly group previously mentioned. Hodgkin's lymphoma is more directly diagnosed now through the understanding developed about the presence of Reed-Sternberg cells as well as its variations. Evidence has now been found that these cancerous cells originate from B-cell lymphocytes, also known as white blood cells. These findings have led to more manageable and effective treatments in patients. Next slide. Can you go ahead and read that slide for us?
Well known when discussing cancer and malignancies, lymphomas are tumors in the immune system. Hodgkin lymphoma is less common than non-Hodgkin, formerly known as Hodgkin's disease.
Over many years, the ABVD, which consists of adriamycin, bleomycin, vinblastine, and dapirolizine, a common chemotherapy combination, has been utilized in the treatment of Hodgkin's lymphoma. As Wayne and John Coravella state in their review, treatment of newly diagnosed advanced state Hodgkin's lymphoma. There are multiple strategies set in this place, such as radiation or autologous stem cell transplantation, which have not demonstrated an improvement in overall survival. However, the combination thereof have proven slightly successful, and there has been success found in another chemotherapy, specifically combination known as BCOP, which consists of bleomycin, etoposide, adriamycin, oncovin, procarbazine, and prednisone. Through continuous research and development, scientists strive for further consolidation of multiple treatments being utilized. Next slide. Can you read that, boss?
Origins of Hodgkin's lymphoma, discovered in 1600s but named in 1865. Named after Thomas Hodgkin, who studied morbid appearance in the body. More frequent in men than women, peak in young adults and ages 60 and up.
Next slide.
Symptoms. Some symptoms include persistent fatigue, fever, and the chills, night sweats, unexplained weight loss. Hodgkin's lymphoma in the body. Not an hereditary-based disease, scientists believe that they have found a pattern to indicate the cause in each age group. Diagnosed based on Reed-Sternberg cells and B cells, lymphocytes.
That's good. And that's just a graph right there. It shows the ages of when diagnosed and the survival chances. As you see, the younger you are, that if you receive a diagnosis, your higher chances of survival rate is. Next slide. Share a little story. It was June 28th, 2012. I went down to Womack. I had a lump growing out my neck. And got to sit down there. I got to sit at Womack for a good 12 hours probably, waiting. And did a CT scan and came back as the Hodgkin's lymphoma. I got to do 6 months, 8 cycles of the ABVD treatment, and 45 days of radiation. All served here at Womack. We got our own oncology department in Womack, which I never was aware of. And I got my last checkup 2 months ago, and now I'm a year in remission. So it's a bad drug or a bad disease to have, but it's pretty beatable and curable. So, any questions? Go ahead, boss.
What was the treatment like?
Terrible. The first treatment was probably the worst. I mean, you go in there, you sit in a chair, get hooked up an IV and a port, and it was probably about 4 hours long of the 4 different drugs they put in you.
Oh, man.
And I got it on Thursday. Then it felt good Thursday night, and then Friday through Sunday I didn't get out of bed. No, as it says, everybody sees like hair falls out. It literally falls out. You can just pluck it out of your head like a week later after the treatment, and your hair just falls out. So, go ahead.
How common is this disease, you know?
The actual percentage rate, I'm not sure of the actual percentage of how common it is. It's the most common lymphoma cancers there is the Hodgkin's lymphoma. And it's seen in up to 26 years of age, and then it goes away until 60 years plus, and it's shown again in the elderly. Go ahead.
More common in males or females?
More common in males. Okay. All in all, the Hodgkin's lymphoma, it continues to constructively perplex the mind and leaving the world the curative possibilities endless. So that's the presentation on Hodgkin's lymphoma. I appreciate it.